Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.
Hello, everyone, and welcome to a fresh episode of Ask the Pediatrician Hour. I am Bimi Boyde. I'm a pediatrician, and it's my pleasure to welcome you to today's broadcast on whichever platform you're watching from or listening to me. Thank you so much for joining us today. I want to thank those of you watching me on Ask the Pediatricians Facebook group or page. Thank you so much for joining us. And for those of you who are watching our YouTube channel, you are warmly welcome. We want to thank those of you who are listening to us on Fresh Waves Radio, as well as maybe watching us on the Fresh Waves Radio Facebook page as well. You are welcome. I also want to appreciate those of you listening on the Ask Dr. Bami ATP podcast. You are even watching, some of you watch the video podcast as well. You are warmly welcome. Thank you so much for joining us. Ask the Pediatricians Hour is a program brought to you by Ask the Pediatricians Foundation, where we discuss important health issues that affect our children and how we as parents we can support our children. So thank you so much for joining us today. I really want to appreciate you. And just to let you know that if you have any questions about any topic that we discuss, you can always head over to our Ask the Pediatrician Facebook group, and you can post your questions there from Mondays to Saturdays, 24 hours daily. Myself and all my colleagues and our moderators, we are there to give you prompt answer to your questions. And if you have any topic you would like us to talk about, feel free to send us an email on askthepediatricians@gmail.com or Dr. Bemi at solar@askthepediatricians.com as well, and we will try and also address this issue. You know, you can always listen to all the past episodes or watch them on our Facebook page, YouTube channel, or you can as well listen to them on the podcast as well. Thank you so much. And if you want live answers to your questions, you can join us on Mondays, 6 to 7 p.m. on Ask the Pediatrician Facebook page, Instagram, and YouTube channel. And we'll be taking live questions and answer. So it's a pleasure to be here today. And today I'm going to be talking about first aid care. We do get a lot of questions from parents on our Facebook group, on all those platforms I've mentioned, where parents kind of don't know what to do when their child has any like medical issues or emergencies, and they are kind of like, what do I do as a first aid? Because sometimes things happen in the middle of the night or things happen and you need to do something first even before you get to the hospital, and you don't really know what to do. So what I'm going to be doing in this episode, and if we can't finish with this broadcast today because I got an hour, we'll take it as part 2 next week as well. So we're going to be looking at the common issues that children can face at home and what you as a mother can do, or as a father as well, because as parents you are the children's first doctors at home, and we expect you to know what to do as first aid before you come over to the hospital. I always encourage parents to take the first aid care courses. There are so many of them, and most of them are available online for free, and you don't have to pay anything, but it's good for you to know because sometimes the first aid care that a child receives before they get to the hospital may make a difference for them between life and death. It is as serious as that. So I really think that all people who are involved in childcare, parents, childminders, those of us who operate daycares, nannies, we should go for the first aid course. We should know how to do basic first aid. So I'm always very surprised when I see questions and I'm like, parents don't know what to do in such instances. I felt it's not good enough. We can do better. We can learn. So we're going to just talk about some of these common issues that you may face as parents at home, common health issues, and what you can do about them before you held over to the hospital. But this is just like an introductory thing for you. I strongly recommend that you go on and just Google for first aid course, free first aid course. Many organizations run them. Some of them are available now online, and you can just do it and be well equipped in case of any emergencies, not only for your own children, but for other families as well. But today I'm just going to start looking at some of these common issues that virtually every parent will face at one point or the other, and how do you deal with them. All right. So the first thing we're going to talk about today is fever. I have some slides that I've prepared earlier for another program, but I'm going to use some of these slides, so don't worry about them. So we're going to talk about fever. Fever is so common. What is fever? Fever, for my fellow parents and colleagues from Nigeria, fever just means a child's body being hot, because a lot of people just think, especially in Nigeria, we always think fever means malaria. Fever does not always mean malaria. Fever just means the child has high body temperature. And I always recommend that every parent, every person who has a child at home should have a digital thermometer. You should have your digital thermometer so that you can always check your children's temperature. Don't rely on your hand. That's our typical traditional method. When you feel people's either on the cheek or on the neck or on the tummy or the chest, you feel like it's hotter to your own hand. But sometimes there are reasons why your hand may not be accurate. If you yourself you're feeling warm, you may actually think a child is warm, whereas you're the one feeling warm. So it is possible to get it wrong. So that's why we don't rely on your hand. Your hand just tells you first that, oh, maybe the body is hot. But the more reliable way to know whether this child actually has fever or not is for you to go grab your digital thermometer. It's available, it's so cheap. There are things we should just have at home in our first aid box, just have it somewhere. Most of them are battery operated. You just put it on and you can read it. They are digital. We no longer use all those mercury one that you're struggling to read it out, and only maybe trained nurses and healthcare professionals can read. These days we have the digital one. So you put it in, the reading comes up, it beeps, and then you can read it straight away. So you should always have a digital thermometer. If you think your child is hot, just check with your thermometer. All right. So now, why is it important for us to know what to do with first aid for fever? Because when your child is hot, sometimes pick it up immediately, or you can't always rush to the hospital straight away, or even if we get to the hospital, we may still delay you a bit. So it's always good to know what to do in terms of fever. And why we're interested in fever, or why we need to know the first stage to when a child is having fever, is because high fever in some children can lead to them having what we call convulsion. So we'll talk about what to do for convulsion itself. So the children start to jerk, and they see even now they can fall and drop. So they start having convulsions because the fever is too high. And for those of you who can see my slide, normal temperature is between 36.5 and 37.4 thereabout, or 37.5. Once it's beginning to get from 37.5 and above, then that child is hot. And when it's getting to like 39, 40, that is very high fever. And those are the ones that if you don't do something about it, it will lead to convulsion. But remember that fever itself is not the diagnosis. Fever just means the child's body is hot, but it's a sign or a symptom of something else going on, So this is a picture of a digital thermometer, just an example of one. There are many of them, and during the COVID era, many of us were even more familiar with the radio infrared ones that you don't even need to touch the child with it. You just, shine it to their forehead and you can read the temperature. But we also have this type that you can put either in the armpits or you can put in the mouth. Just follow the instruction of whichever form of digital thermometer you have, or even if it's the infrared one you have, whichever one. Just follow the instruction on how to use it, and then you can read straight away. Usually some of them you have to put it on for like 2 minutes, or you will hear a beep when it has finished calibrating and it has read the temperature of the child, and then you can look at it. So anything above 37.5 is high, that's fever. So what is the first aid that we can do for fever? And remember that there are many things that can cause fever. Fever sometimes just means that the child is hot, the environment is hot, especially if you're in the hot sun during the hot season. Children can be hot because they are wearing all these layers of clothes, or sometimes you just need to take off those clothes. Sometimes it's good. Fever can also be a sign of the dehydration in children. But sometimes it also means a child is ill from things like malaria, from infections, and infection can be due to viruses or bacteria or parasites or fungal. There are many things that can cause infections. So fever can be first sign you see in that. Sometimes children have taken immunization. They can also have fever as side effects. So some serious or sinister causes of fever include things like cancers or other rare conditions, children with immunosuppressive illnesses, and like HIV, for example, they can have continuous persistent fever. So there are many, many, many causes of fever, but that is not the focus today. The focus today is what is the first aid for fever. So if your child is having fever, what can you do so that the child does not start having convulsion as a result of the high fever? That is what I'm going to really talk about. And so first aid for fever, the easiest thing to do if a child is hot is just take off the clothes. Some of you see when you come to the hospital and immediately come to the pediatrician's room or your doctor's room and they feel the child is hot, or the nurses are taking the vital signs and they can see the temperature is like through the roof already. The first thing they do is to start taking off the clothes of the child. So that is the easiest thing to do. Just take off the clothes. So I'm always surprised sometimes you see a child is boiling. I mean, it's very hot, and then the parents are still wearing clothes and covering on. The first thing the health professionals will tell you is that just take off the clothes, take off the clothes. So removing the clothes, the first thing you can easily do. So if your child is having fever, that's not the time to still keep wearing them layers, especially for the newborn babies. Some people believe they must always be clothed and everything, even when they are hot. No, you should take off the clothes. All right, that's the first thing. Sometimes just taking off the clothes and putting on your fan or your AC, that's what we call exposing the child in medical jargons. It will just sometimes bring down the fever. If you remember all the process of heat loss we learned in physics, there's convection, there's conduction, there's radiation as well. So just exposing them and the fresh air and breeze is blowing the child, it will take away some of the heat from the child and may lower the temperature. So that is the first thing as a first aid that you can do. Secondly, you can give the child a cool bath, or what we call tepid sponge. So a lot of people get tepid sponging wrong. So we don't want you to use cold water. It is not cold water, neither is it hot water. It is what we call normal tap water temperature. In other words, the way your water feels when you open your tap, that is what it tends to be lukewarm. It's not like cold, like that will make the child to shiver, and neither is it like hot, it's just lukewarm, tepid. That's what we call it, or like tap water kind of level of temperature. So you can give your child a bath with that. And when you do that, don't dry them off straight away. Just, they can wear their pants and they allow the air to circulate around them, and it will take off some of those temperature, and I mean some of the heats and the fever, and in that process sometimes the temperature will begin to drop. All right, or if you don't want the child to have a bath, you can just get like a hand towel or face towel, put it in the same tap temperature level kind of water, and then squeeze it out a bit, not completely, a little bit. There must be some water inside, and then you just dab it on the child's body like that, dab it, and then let some water remain as you're doing that. And then it's a very tedious process. You keep doing it and keep doing it, and the temperature will be falling down, it will be coming down. So and sometimes when you're doing that, you also use your thermometer to check whether the temperature is coming down. So you can either expose the child and you cannot tap a sponge, and you can do the two together. So each of this method is not like, okay, when I'm doing this, I don't have to do that. Sometimes you have to do all the three or all the four, depending on how high, especially the child is having very high fever, like 39, 40, and you really, really need to crash that fever before the child start convulsing. So you can expose, quickly give a cool bath or tap a sponge. And of course, you can also give what we call antipyretics. Antipyretics are drugs that reduces fever. The commonest, of course, is paracetamol. So you can give paracetamol to reduce the fever. Sometimes you can also give things like ibuprofen. So it will, these are things we should always have at home. You should always have paracetamol at home. As a mom, as a dad, as caregivers of children, we should always have paracetamol. It can be syrup, it can be tablet. We must always have paracetamol at home. And don't worry, I don't know the weight of the child. How do I know the dose? Just follow the age guide. Okay, if they say it's this 6 months or 2 years, give 5 meals, just follow the age guide when you are under that kind of pressure. But if you are a mom that is more knowledgeable and you know how to calculate the weight and the dose and all that, you can do that. Or if you can ask the pediatricians, and we can really work it out for you as well. But don't worry about that. Just follow whatever recommendation is written on the pack, or like based on the age of the child. There's always something on the pack on the age of the child and the dose of paracetamol that you should give. So first aid for fever: reduce, take off the clothes, expose the child. To can tap a sponge or give a cool bath, and of course you can also give paracetamol. Exposing them, you can use the fan, you can use the AC. All these are methods by which you can use to bring down fever in children. And of course you check the temperature. And when you're giving drugs like paracetamol, remember that you can actually give it more than once. You can actually give it every 4 hours, but usually I would tell parents every 6 hours. So in other words, it's not that you give one and then that's it for the whole day. No, you can actually repeat it every 6 hours, and each time you give, you are checking the temperature to see whether it is coming down or not. So these are ways by which you can reduce the fever before you go to the hospital to now see a doctor who will investigate to know the cause of the fever and treat the underlying cause of the fever. So that is how to manage a child who is having fever. I've written in my slides for those who can see how to calculate the dose of the paracetamol. But like I said, the easiest is just follow whatever is recommended for the age of the child, because usually at that time most men are panicky and all that. So I don't want you to that's not the time to start racking your brain. How is it 15 milligrams? Is it 10 milligrams? Don't worry, just follow the dose recommended. And please, if you are giving paracetamol drops, versus if you're giving paracetamol syrup, they are not the same thing. The dose, the concentration, or the way it is formulated are different. So for example, most paracetamol drops actually have 100 milligram of paracetamol in 1 ml. 100 milligram in 1 ml, whereas most paracetamol syrup have 120 milligram in 5 meals. So it's a lot. So usually for babies, newborn babies that take the drops, they only need very little drops of the paracetamol. Whereas for the older children, let's say from 3 months and above, when you give them paracetamol syrup, they take a larger volume, but they are still getting the same, the amount of milligram is still be the same. So you have to be very careful if you are giving drops or if you are giving syrup, so that you don't give the wrong too much of it. We don't want to give too much of paracetamol as well, because paracetamol can damage liver if it's given excessive dosage. So you can use paracetamol, you can use ibuprofen. What we don't recommend you use is acetyl salicylate. or what is commonly sold as Fensic, or which other brand name? I can't remember the other name, but I'll remember later. But it's acetyl salicylate. So please, you should avoid hearsay in children, because some children can have a severe reaction to it and have what we call Rice syndrome, where they have what we call like excessive liver failure, because you give them, depending on the kind of illness they have, you don't give them salicylic acid. You don't want to give that. So you don't want to give things like Fancy, I think Daga or something like that. There are different brand names of it, but just avoid that at all in children. Okay, avoid them as much. Aspirin, yes, aspirin is the name I was looking for. Avoid aspirin, avoid things like that in children. Please give them mostly paracetamol or ibuprofen for fever, and that's how to reduce fever. Okay, and remember that reducing the fever is just a temporary measure. The most important thing is to address the underlying cause of the fever. Okay, and so that's why you should take the child to the hospital. And most of us, we listen to that common adverts, that's all these paracetamol adverts that they give on the TV, and they'll say if the symptom doesn't go away after 2 days, and go and see your doctor. Some of us think it is just they are just saying it for saying it sake. No, it's a very important thing. So if your child has fever and you're trying to bring it down, you're doing hot the cool bath. Usually, most time the temperature will come down, but it can come up again, and you give the paracetamol. So if it keeps coming back again, like after one day, the second day, the fever is still there, you need to take the child to the hospital. And or if the fever is even very high from day one, like 3940, you still have to go to the hospital. No matter what else you have done to bring down the fever, you need to take the child to the hospital and let the doctor have a quick evaluation of the child, so that they can treat the underlying cause of the fever. It's so important that we don't I'll see people tell me my child has been having fever for 1 week. And I'm like, what are you waiting for? What else are you waiting for before you decide to take the child to the hospital? So if child is having fever for more than 24 hours, please go to the hospital. Even though the fever is coming down when you give paracetamol, it's coming down when you give tepespongin or you do all those things, but you still have to take the child to the hospital for proper evaluation and treatment. All right, so I'm going to stop with fever there, but it's one of the most common issues that children have, and it is one that all parents should know what to do. All right, so don't start treating a child with anti-malaria or antibiotic, which is what most parents do. Actually, for those who are listening to me in Nigeria, it's wrong. Don't abuse drugs. You don't know what is causing the fever, so don't just start treating it. The most important thing is to bring down the fever first. Once you bring down the fever, then go to the hospital and let the doctor do their examination, then do their own test, and then they can treat the cause of the fever. Now, let's go to the second thing which I want to talk about, and that is diarrhea. Diarrhea is also a very common issues that children do have. Sometimes it comes with vomiting as well. So what are the first aid treatment for diarrhea before you go to the hospital? Sometimes when it comes with vomiting, most people always ask me, what can we do to stop vomiting? The honest truth is that there's nothing you can do at home to stop vomiting. If a child is vomiting, watch them. You can still give the same treatment like for diarrhea, but if the vomiting persists or they can't even drink the ORS and they're vomiting the ORS, you just have to take them to the hospital, because most of the things we use to stop vomiting is not something that as parents you can do at home. So we usually have to see the child in the hospital. So vomiting, that's not first aid. Don't go and be giving all those drugs like Phenergan, chlorpheniramine. Many parents just say, well, go and give that. Don't. I've seen children collapse, from Phenergan and they died, and that's how bad the idiosyncratic reaction that is a reaction that you can't explain, that is something that can just happen to some people. That's how bad it is. So it's not a drug that we want parents using. It's a drug that even some of us as pediatricians are very, very reluctant to use. So when I see parents just using it with so much impunity, I'm shaking, like, really, So please don't be using Phenergan or giving any of those drugs. If your child is vomiting, you have to go to the hospital. There's no other first aid. It's hospital. For vomiting that is persistent, you have to go to the hospital. All right. So for diarrhea number one means passing watery stools that more than 3 times a day. All right, we count it as diarrhea. The reason why I need to define diarrhea is that some ask us questions and say, "Oh, my child is passing lots of stools, and what can I give?" And some people started giving all the usual things I'm going to tell you not to give at the end of this section. All right, so please, a child passing stool 5, 6, 7 times a day does not automatically mean the child has diarrhea. The child has to pass watery stool. And you see that when you ask this kind of question in our group, the first question we're always asking you, if you have not included, is that what is the texture? What is the nature of the stool? All right. So parents tend to use the word stooling, and when you're asking questions, don't just say my child is stooling. How many times and what is the texture? So even if your child passed stool 20 times, as long as the stools are not watery, it is not diarrhea and it is not abnormal. I know parents find that hard to take in, but it is not. As long as the stools are not watery, it is not diarrhea. And when we say watery, it means it looks like water, like urine, like you can pour it, it will take the shape of a container. Or if your child is wearing nappy, it will sink through the nappy like urine. That is what diarrhea is. But if your child is passing, because some babies, newborn babies especially, and some other children, they pass stools that are soft. It's not like thick, solid like adult one, but they are soft stool, but they are still not watery stool. Those still don't count as diarrhea. Okay, so diarrhea has to be like watery, and it has to flow or take the shape of a container or sink into the diaper or nappy, and it must occur more than 3 times a day. Also, sometimes we see if it is very like explosive watery one, we would even take one of those, but most of the normal watery one, the child must have passed it 3 times a day for you to say this is diarrhea. And unfortunately, diarrhea is one of the leading killers of our children, which should never happen. Okay, diarrhea should not kill children, but I can tell you a lot of mothers have come to my inbox and told me, "Oh, my child just started passing diarrhea," and before you know it, the child is dead. And they're always like so surprised and so shocked. And I feel so bad for parents when they come to meet me like that. And it's like you think it's something so simple, something not so big. And most of the parents are saying, like some of my Nigerian Yoruba people will say it's igbeyin, like it is teething causing it, and they are not taking it serious. And before you know, the child is dead. So children can easily die from diarrhea, and diarrhea is the leading cause of death in under 5 children in Africa, sub-Saharan Africa. And the reason is because parents don't use the right first aid for diarrhea, or they take it with something not to worry about, as something trivial. We take it as something trivial. It is not. Diarrhea is a killer. So diarrhea can kill children. So we really need to know how to do first aid for diarrhea. In fact, most times you only need to treat diarrhea at home, because what kills children in diarrhea is not the fact that the child is passing watery stool. It is the water and the electrolyte that the child is losing. And children can easily lose so much water and electrolytes that they become dehydrated and they can go into shock, and they can die from that. So the most important thing in diarrhea, which is the first aid, is to replace what the child is losing. Okay, most times we focus on the how do I stop the diarrhea? No, don't focus. That's not the point. The diarrhea can go on. Sometimes you can't stop them. They will go on for as long as it will take the virus to run its course, which can be up to 10 to 14 days. So that is not the problem. We don't recommend all these drugs to stop diarrhea. We don't especially recommend them in children. The most important thing, it is not the diarrhea that's going to kill the child, it is the dehydration, it is the loss of the water, loss of electrolytes. That is what is going to kill the child. So as long as we are replacing that water and the electrolyte that the child is losing, the child is not going to die, no matter how long the diarrhea lasts for. As long as you're replacing that water and the electrolytes, there's nothing going to happen to the child. So the primary focus is rehydration, replacing the water and those electrolytes. And the easiest way to do it is to give what we all are familiar with, oral rehydration solution. Is available. You can make it by yourself. We just need common stuff. Every home always have sugar and salt. It is like common thing that we all always have at home. So if you don't even have the ORS sachet that they are selling in the shops, in the pharmacy, in even your normal supermarket, they will sell ORS. If you don't have it, you can make your salt and your sugar at home. You can use it to make your own salt sugar solution, which is a close equivalent, and give it to the child. As long as we are replacing that. So, and I always tell parents, you should. So again, just like having your digital thermometer at home, you should always have ORS at home. You should always have it. There are some things you should always have at home. You must have it in your first aid box. Your paracetamol, your digital thermometer, your ORS. You must always have it at home. But if you don't have the ORS, you can have your salt and your sugar, but you must know how to mix it so that you can. But if the ORS is easier for you, so you just take the sachet. It usually goes into 1 liter of water. So you can boil your water and measure. Most of us have all these cups that have graduation on them, so you know what 1 liter is. If you're not sure, there are some bottles you have at home that you can use to work out 1 liter. Like some of these Ever bottle is 1.5 liters. So if you decant it to the first line on the neck, it will give you 1 liter. Or if some of us have our soft drink bottles like Fanta or Coke, some of them are 35 cl, some of them are 50 cl. If you wash them very well first, then rinse them thoroughly, then use them to measure out your water and boil the water, cool it again. You can get but just have your cups or even your baby's bottle. They all have some measurements on them. So just make sure it's 1 liter of water and 1 sachet of the ORS. Mix it together, shake it very well, and let the child be drinking it. You can give it with spoon for the younger children. You can give it with cup, and there's no overdose. The child can drink as much as they want, but usually we recommend that you finish 1 bottle in 24 hours. So if you don't finish a 1 bottle in 24 hours, you need to make a fresh one. Don't use it more than 24 hours. So you must know how to make the ORS. If you don't have the ORS, you can use 10 cubes of sugar and 1 teaspoon of salt, level teaspoon of salt, and add it to 600 to 700 mils of water. And then that's how you mix it and give the child. It will taste like tea or like coconut water. So that's how to make your own ORS. If you don't have cube sugar, you can use 10 level tablespoon of sugar, 1 level teaspoon of salt. Please note that the tablespoon is for sugar, the teaspoon is for salt. It's so important so that we don't mix it up. But to avoid all this confusion, just buy your ORS. And you can either make it or you can use your ORS. It's so important that we just let the child be drinking. Even if it's just 1 spoon at every, there's a way we pediatrician will calculate the quantity of water the child can drink and all that. But for parents, I don't usually think you need to stress yourself. Just let the child drink as much. If your child is saying, I'm thirsty, that means that child is dehydrated. You need to let the child drink more. If your child is not thirsty, just drink. Anytime the child passes watery stool again, give more of the ORS. Let the child be drinking more of the ORS. As long as the child is rehydrated, it's better than ordinary water. So sometimes some parents just give ordinary water because the child is not losing just only water. The child is losing the electrolytes. So it is not appropriate to just use only water. It's okay to drink the water as well, but in addition, the child is best to drink ORS or salt sugar solution, so that the child is also getting back some electrolytes, the sodium, the chloride, and even the glucose from the sugar. So the child needs all that. So that's what we need to give. Or you can even use your, like, if you, some people cook rice, the water on top of your rice, and you put salt in that rice. You can also give it coconut water, so you can use it. There are so many things, other close fluid. The most important thing is that the child must be rehydrated as much as possible. So after each two, if your child is less than 2 years old, you can give them half a cup. The child is between 2 and 10 years old, you can give them 1 cup. For 10-year-old, they can drink as much as they like. So the most important thing is to rehydrate the child. That's the first aid care for diarrhea at home. So always have, if you are in some shops and sophisticated places these days, they will sell oral zinc with the ORS. In other words, whenever you're buying oral zinc, there's right. Whenever you're buying ORS sachet, there's the oral zinc that comes with it. You can also give the child that. But more importantly, please make sure you give ORS, all the salt sugar solution. Don't give them juice or fizzy drinks, Coke, Fanta, all those things. Those soda drinks, avoid that, at that time. And some people say, oh, the child is having diarrhea, let's not give food, because giving food will make the child to pass more water through. That is a wrong error. That's an error. The child actually needs to eat more food, all right? But don't give food that are spicy, that are too flavored, that are what we call high osmotic load and all that. Give the child things that the child will be able to tolerate, like your plain pap, plain food, not too difficult for the child to eat. So you can give that, but please do not starve the child. The child needs to eat more. And please do not give them drugs to stop diarrhea. Things like people will go and give diet stop, tetracycline, all those things. Please do not give children. Do not attempt to stop diarrhea in children. Is a very dangerous thing to do. All right, today's about first aid, so I'm not going to emphasize more. If you want to know more, I think we've done a whole session on broadcast on diarrhea itself. You may want to listen to that, or you may want to read on our website about home treatment of diarrhea and explanation for that. But please do not give children all these drugs. Yesterday, a mother was asking a question because her child was having diarrhea. She wants to give flagyl, metronidazole, which again is something we should not be doing. That's an abuse of antibiotic. And in the process, she went to end up giving the child another drug, I think a drug for blood pressure. So please, some of these drugs we just like to give children is wrong. And I know in Nigeria, it's almost like an epidemic. Like when people just give flagyl, if you are even going to overeat or you are going to go to a party, people will say just take your metronidazole or flagyl before or after. This is abuse of antibiotics. So please do not give children antibiotics at all when they have diarrhea. Antibiotics can only be given if the child is passing blood in the stool, or if there's other infection. That is a doctor that has to prescribe it. It's not part of your first aid as a mother. The only thing we want you to give as a mother is ORS or salt sugar solution or just water, or like any of those home, like weak tea, like rice water and all those things. You can also give that as well. But please do not give all those dangerous drugs, Lomotil, Diastop, tetracycline, flagyl. Please, Septrin, do not give it. It's a very dangerous practice. Just remember diarrhea, ORS, diarrhea, ORS. And when you're giving your children ORS and SSS, all the liquid, you must also be aware of, these are what we call first aid care. So there's a point where you have to say go to the hospital in diarrhea. So you should know when to go to the hospital in diarrhea. The first one, which most parents sometimes take for granted, is if your child is not drinking the ORS, if your child is not able to drink the ORS, or your child is vomiting it, you have to go to the hospital. As I've stated earlier, there is no first aid for vomiting at home. There is none. So you just have to take that child to the hospital. So if your child is having diarrhea and is not able to drink, some children don't like to drink the ORS, they don't like the taste. We've tried to find solutions to that. We have ORS that are flavored. We have orange flavor, banana flavor. So you can use some of those flavored ones as for children that don't drink the normal ORS. But if your child is not able to drink any of them, whether flavored, not flavored, the salt sugar solution, the child is not able to drink at all, or the child is vomiting them, then you have to go to the hospital. There is nothing else you have to do. Because like I said, there are many children, millions, are still dying from diarrhea every year under the age of 5. Why? Because of this, because people would think, oh, diarrhea is something so simple, something so trivial, but it's killing children. And why is it killing children? Is because when a child is having diarrhea and is not able to drink or is vomiting, somebody is just there looking at the child until the child dies, instead of them taking the child to the hospital. Because if the child is not able to drink through the mouth, or the child is vomiting the liquid that we give through the mouth, we have no choice than to pass in to rehydrate the child, to pass in the fluid through the veins. So we have to do what we call intravenous rehydration. Sometimes we try sometimes to do it in situ, but sometimes we just have to set up a line, set up something that can deliver the fluid into the child's blood. Because like I said, what is going to kill that child is not the stool, is the dehydration. So we have to replace what the child is losing. So a child who is not able to drink, a child who is vomiting, that child needs to go to the hospital. If your child is so thirsty, even despite all your ORS, the child is always thirsty, that means the child is already dehydrated, maybe moderately dehydrated, or the child is becoming unconscious, drowsy, the child is not responding again, that child is going into shock. Once there's a change in the way the child is responding, you have to go to the hospital. Please don't say I'm still giving ORS. No, that one is gotten to the stage where doctors have to intervene. All right. If there's blood in the stool, if there's fever, you have to take the child to the hospital. If the diarrhea is going for more than 3 days and it's still so much and you are not seeming to be making headway, the child is still dehydrated, the child is sick, the child is weak, you have to take the child to the hospital. So you must know when to take the child to the hospital. And when your child is having diarrhea, please pay attention to hygiene, washing your hands when you're making your ORS. I've already said change your ORS after every 24 hours and all that. Please don't stop breastfeeding the children. Please boil the drinking water. Please take your rotavirus vaccine, your measles vaccine. These are things that protect children against diarrhea. So most important thing for us to remember when it comes to diarrhea is rehydration. You must, as the child is passing out the water through the diarrhea, you have to replace it. So whether it's ORS, whether it's salt sugar solution, you must replace what the child is losing. So we've talked about fever, we've talked about diarrhea. So I'm going to talk about one more thing, and the first aid care for it at home. And I think I'm going to come back next week to do the part 2 because there's not enough time to handle all of them. So let's talk about cough and catarrh, because that's another one that many parents do ask us. Cough and colds is so common, especially during certain season, during the rainy season, or in those who live outside the tropical environment during their winter and all that. So children tend to have a lot of coughs, a lot of colds, and parents sometimes don't know what to do. Sometimes the children nose are blocked. Sometimes they're struggling to breathe because of the cough and the colds. So what are the first 8 things that you can do at home for your child who is having cough and cold? Let's start by saying that most cough and colds are due to viruses. They are caused by viral infections. So the importance of knowing that is that most of them don't need any drugs. They don't need any antibiotics, because actually in Africa, Nigeria, we tend to abuse antibiotics a lot because we have ease of access to anybody can walk into any shops and buy any antibiotic they like, which is not possible in other countries. So I'm hoping our pharmacist colleague, they're working hard, and I hope they keep working hard so that we don't let parents have access to antibiotics unless it has been prescribed by a doctor. That is that is how it should be in normal situation. So a situation where parents just go in and they buy things like augmentin, like Zena, and they use it like pure water. It's not good. We are ending up creating what we call antibiotic resistance, and we are not developing many more antibiotics. So if our children are resistant to this common antibiotics, then when they are really sick and need those antibiotics, it may not work for them, and then we're in trouble because if the child is not responding to the common antibiotics, we have to go for the more expensive one. And sometimes children are not responding, then we have nowhere to go. So please don't train your children with just giving them antibiotics irresponsibly. Please, parents, let's use antibiotics only if it is prescribed by a pediatrician. I'm saying that with all sense of responsibility, and I'm pleading with us to also, because some of us don't see it as serious. Antibiotic resistance is an epidemic, is something we have no arsenal to fight, because once we get to a point where a child is not responding to antibiotics, we have something else we can do. It can be death sentence. So please let your children not be used to antibiotics so that when they now have need of antibiotics, we can use simple antibiotics like amoxicillin and they will respond. Not that some parents use things like augmentin, and these are very high level antibiotics that it should not be used routinely for common community infections. So please, let's avoid using antibiotics for cough and cold and catarrh just because we have access to them. Most of them are due to viruses, so they don't need any antibiotics, okay? Most of them are going to run their course. So most viral infections don't need any drugs. They will run their course and they will stop. They will go by themselves. So usually for things like that, what we do in medicine is what we call symptomatic management. In other words, you just support the child while waiting for the thing to go by itself. So let's focus for cough and catarrh. The important is to make the child comfortable. So let's make sure they are drinking enough water. Okay, let's make sure that they are well hydrated. Sometimes some children have like block the catarrh for the babies, the who cannot really help themselves much. So for the older children, they tend to sneeze, and when they sneeze, all the mucus will flow out, which we can clean, and then they can breathe well. But for the babies, sometimes they cannot easily help themselves to get out the thick mucus. So for them, sometimes we can put in what we call like saline, the normal saline drops. The goal of the saline drop is not a drug to stop the catarrh or the cough. It's just something to soften the thick mucus that is blocking the nostril so that it will flow out and then the child can breathe and then the child will be fine. So a lot of parents, Dr. Boy, they have used a lot of saline drops, the catarrh is there, and I'm like, yeah, the catarrh will go by itself. The saline drops is not the drugs to treat your catarrh. A lot of parents also rely on giving vitamin C. There's nothing wrong with giving vitamin C. Vitamin C is a vitamin that children need, but it's not like a cure or a treatment. Vitamin C is just one of those vitamins that strengthen the body's immune system to fight against all these viruses anyway. So ideally, we should have been eating a lot of our fruits and veggies so that the children would have the vitamin C already. So it's not only when they now have cough and catarrh, we'll now start overdosing or overloading them with vitamin C. They should eat normally. They should eat their fruits and their veggies, and then they will get their daily supply of vitamin C even from the food. But if you are not sure your children are eating the veggies and the vegetables and the fruits, then if you want to, be sure, then it's okay to give the vitamin C. Please just follow the dose written on it. Don't just keep giving too much dose of it. Luckily, vitamin C is water soluble, so children will pass out any excess in the urine. All right. So, but the most important thing is let the children be well hydrated. Let's help them clear their nose of any blocked mucus. We can put saline drops. Some do steam inhalation. Steam inhalation is fine, but the challenge with that is hot water and children don't mix very well. hot water and children don't mix very well. I've seen a lot of cases of burns even in newborn babies, as small like newborn babies having hot water burns is horrible. So because of that, I'm not a fan of promoting steam inhalation, because parents have to be very careful, and sometimes parents are so overwhelmed and we are not paying much attention, and students can easily pour all this water on themselves. So if you have to do it, please be mindful of the need to be very, very careful, so that your children don't start with cough and catarrh and end up with hot water burns. It's more hot water burns is more dangerous, or more 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 challenging to deal with than a child who is just having ordinary cough and catarrh. So because of that, I'm very careful saying hot water burns. Now, a lot of parents like to go use cough syrups and all the so-called catarrh syrup as well. We don't recommend most of them, as especially for our children below the age of 1. I will even go for that and say below the age of 2. Children who cannot tell us how they're feeling, children who are not talking. It's very dangerous loading those children with cough syrup. Cough syrup is not the treatment for the cough. All right. So what cough syrup does is to suppress the cough, and sometimes they even suppress the breathing of children, so which is a dangerous thing, because children are what we call obligate nasal breathers. Children needs to breathe, and we don't want anything suppressing that breathing, and they have to breathe through their nose. And so if you give them drugs that make them drowsy, that makes them suppress their breathing and all that, they can go into what we call respiratory failure, and you won't even know it. Again, that's why some children die from pneumonia. So if a child is having cough and it's not going, and they are not having difficulty with breathing with it, they are not having fast breathing with it, they are not having fever with it, you need to take them to the hospital, because it may not be those viral infection. This child will be having pneumonia. But if you are giving them cough syrup and all that, number one, you suppress the cough itself. Number two, you suppress their respiration, and then you don't pick up, because this children cannot tell you that I'm having chest pain or I'm struggling to breathe. They can talk, they are not verbal. So you will miss some of the early signs that tells you that this child may be having pneumonia, that you need to take this child to the hospital, this child will need antibiotics. You may miss it because you are very comfortable that, okay, I've given cough syrup, the child is not coughing again. The fact that the child is not coughing much because of a cough syrup does not mean that it is all well and good. It may actually mean there's something more serious going on. So please do not give cough syrup to children. All right. So if your child is coughing, let them be hydrated, and keep them warm if they are cold. If your child is already hot, don't keep them warm, because a lot of people like, oh, my child is already sweating and other. How do I keep them warm? The advice to keep children warm is for if the child is cold. So like you can feel the extremities are cold, their legs are cold, maybe because the weather is, temperature is low, then that is when you keep warm. You can wear them extra layers of clothes to keep them warm and all that, but not, you can give them warm food, warm everything. But that's not to say a child who is already sweating, you now go and wear them sweater and all that, make them sweat and have itch rashes. Please, no. I believe we all know what to do as sensible parents that we have. So please be very careful. But no cough syrup, no. There are some syrup that have been sold for catarrh and also, no, we don't recommend that. So don't do that. So, but if your child is having cough, fever, fast breathing, then you need to take the child to the hospital, because pneumonia again is another killer of our children. So, and it starts sometimes with cough, but the way we know a child is having pneumonia is that they breathe fast, and sometimes they are struggling to breathe. They are making this what we call grunting sounds when they're breathing and all that. So when we start seeing fast breathing, fever, difficulty with breathing, you see their nose flaring, you see some holes in the next signs of what we call respiratory distress, then that's when you need to take them to the hospital and not just to assume, oh, it is still cough or viral infection. Cough or viral infection, most time within 2 weeks, the children are fine. And the children are otherwise well. They are having their catarrh and cough, but they are otherwise well, playing, eating well. They are well, even though with the cough and the catarrh, they are not like very sick. So if a child is very sick, having fever, having cough, struggling, or coughing to the point that they are vomiting, and all that, because we've had a wave of diphtheria and some of these other vaccine preventable kind of respiratory infection recently. So if a child is very ill with the cough and the catarrh, with the fever, with the fast breath, please, those are not the ones that are going to go by themselves. Those are when you need to take the child to the hospital. All right, I'm going to stop here. This is part 1 of the first aid care. So I've talked about what are the first aid care for fever, first aid care for diarrhea, and first aid care for cough and colds. And I've told us there's no first aid care for vomiting. If a child is vomiting persistently, you have to take them to the hospital. So thank you so much for listening to that. Like I said, you can ask your questions on our Facebook group. You can read some of these things on our website, and you can watch it again, or you can listen on my podcast as well. So if we are bearing in mind these first aid things and we practice them, our children will be fine. And remember, I also recommend that as parents, we go for all these first aid courses. I do share links for them on our Facebook group. And if you just Google them, I'm sure you will see. Most of them are free, because knowing what to do, knowing first aid care is something that can make a difference between life and death. So it is something that we all should know. And so I'm just focusing on the ones on the common issues in children. And so if you're just joining us, please make sure if you're watching this as a rebroadcast, or later on after the lives, please make sure you listen to it from the beginning, so you know what to do if your child has fever, if your child has diarrhea, if your child has cough and colds. This thing should not be killing our children if we are doing the right thing. Next week, I'm going to talk to us about what to do when our children have convulsions, when our children have falls, injuries, accident at home, and when our children accidentally take things they should not take, accidental poisonings. Those are the things I will talk about in this part 2 of this first aid care for children. Thank you so much for listening. And if you still have questions, you can post on our group, or you can email me at drbidisola@axpediatricians.com. Till I come your way again next time, same platform. Have a wonderful, wonderful day, and keep making our children healthy.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Pediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Pediatricians with Dr. Bami, because it's informative, educative, and interactive. Ask the Pediatricians Hour, the program for caring parents.